Hi everyone, it's Janice Martel from the McIntyre Powder Project. I just decided to do a little bit of a video to give people updates as to what's going on with the project. So far, I've had 43 names of minors registered. I've had a lot of questions around, what kinds of things are you seeing, who's registering. About half of the names that I have are deceased. So these are the widows, the survivors, the children and grandchildren who are contacting our project saying, hey, this happened to my dad or my uncle or my husband. They were exposed to this, they died of Alzheimer's or Parkinson's or lung cancers, different things like that. So far I'm sad to say that there's that many names already, in the sense that my instincts, I think, were correct. That a lot of the miners who were exposed to aluminum dust also had health issues. It doesn't mean that one caused the other, but it's a start to hopefully get some research done to compare to the general population how many of these miners have health issues which may be related to their exposure to the aluminum dust in the mines. So thus far, I have 43 names on my voluntary registry. So how that happens is people have contacted me through the website, through my Yahoo email address, through Facebook, in person. I've gone out to in Elliott Lake and in Timmins to some events. All of the miners on my list are from the Elliott Lake and Timmins area mining camps. So people from who worked at Rio Algom, Denison, the Dome in Hollinger, McIntyre mines, a few other mines up in the Timmins area. The types of health issues that I'm seeing are about half of the people who have registered have neurological disorders. So Parkinson's, Alzheimer's dementia, one with essential tremor, one with some short-term memory problems. So that was about 21 of the 43 miners so far who have registered. Another 11 or so had silicosis. So silicosis is the lung disease caused by silica dust and exposure to silica dust in the mines. And the breathing in of the McIntyre powder aluminum dust was supposed to prevent silicosis. So that clearly hasn't happened. I have about 40% of the 43 names on the list have cardiopulmonary type issues, and that's a variety of things. That does not include the silicosis, which is a pulmonary disorder. That's on separate and apart from that. So about 17 of the names on the list. Heart problems. I'm really concerned over the amount of people coming forward saying that they've got breathing problems, coughing, constant coughing, productive coughing, bringing up lots of phlegm and such, breathing upon exertion, those kinds of issues which are concerning to me because I know that silicosis from my research takes generally about 30 years to develop. It can be a lot shorter than that, but some of the symptoms come out later on. So I'm a little concerned that we may see a spike in silicosis diagnoses or other cardiopulmonary type diagnoses from former miners who were exposed to the aluminum dust. As the daughter of a miner who is suffering now from Parkinson's and watching him struggle, I know that is that's a very difficult thing to watch. And for the miners who are out there who may not have diagnoses, who are coughing and having breathing problems, I'm not a doctor obviously, but I would strongly encourage you to go and see your family physician, go and see a specialist. let them know about your mining history if that helps in the kind of dusts and other things that you were exposed to in the mines. But please go get checked out. I'm just fear that we're going to see more diagnoses, and certainly whether or not you have anything to do with my project, it's more important that your health gets monitored and checked out. It's hard watching someone that you love struggle, and for the sakes of your families and the people who love you, please go get checked out. So a couple of things I just wanted to share with you then. I've had some questions about the voluntary registry. It is voluntary, meaning if you're going to provide me with your health information, you're doing that of your own accord. People have said, you know, that if I provide a name, do you have to apply for compensation or whatever? You do not. Basically, I'm trying to gather the incidents of people who have been exposed to this. So I'm more or less just trying to get an idea of how many people who were exposed to McIntyre powder aluminum dust, did have health issues, whether they're deceased or not. It's helpful to just sort of get an idea of the numbers so that we can start to get an idea of is this something that we want to look into further and have some of the medical experts and scientific experts look into a little bit further. So I keep a non-identifying list of people who have registered. I am aware of there's many more people who have not registered as of yet, but I'm hearing the names of others who have neurological disorders and other things who were in the mines. So I'd like to just go over the list of the people who have registered so far, non-identifying. There's a couple of the ones on here that have very specific sort of rare autoimmune disorders that I'm just going to refer to as an autoimmune disorder so that I don't in any way identify them. There are 43 names on this list. They're multiple issues. So I'm just going to read them sort of person by person and the kinds of issues that they have. Number 1, Parkinson's and rheumatoid arthritis. Number 2, Parkinson's. Number 3, silicosis. Minor number 4, silicosis and an autoimmune disorder, deceased. Number 5, Parkinson's and dementia, deceased. Number 6, silicosis and black lungs. Number 7, high body aluminum levels requiring chelation therapy to bring down the aluminum content in his body. Number 8, Parkinson's, deceased. Number 9, silicosis in cancer, deceased. Number 10, shortness of breath with no diagnosis yet. Number 11, silicosis, deceased. Number 12, lung cancer, deceased. Number 13, dementia, deceased. Number 14, silicosis, deceased. Number 15, silicosis, deceased. Number 16, Parkinson's and dementia. Number 17, Parkinson's and lung cancer, deceased. Number 18, Parkinson's. Number 19, Alzheimer's, deceased. Number 20, silicosis, deceased. Number 21, Alzheimer's, deceased. Number 22, essential tremor and an autoimmune disorder. Number 23, silicosis and prostate cancer, deceased. Number 24, silicosis. Number 25, chronic cough and lack of endurance, but no diagnosis prior to his death, deceased. Number 26, Alzheimer's and emphysema, deceased. Number 27, Parkinson's, deceased. Number 28, bone density problems. Number 29, Alzheimer's, deceased. Number 30, breathing problems, so difficulty catching breath for 5 or more years, excessive throat clearing. Number 31, breathing problems, gasping for breath, especially upon exertion. Number 32, black lungs, stroke at the age of 53, deceased approximately age 84. Number 33, Alzheimer's, deceased. Number 34, Parkinson's, Alzheimer's, lung problems, deceased. Number 35, half of his lung was removed. Number 36, sarcoidosis, and COPD. Number 37, Alzheimer's, lung lesions, heart condition, skin cancer. Number 38, silicosis. Number 39, short-term memory problems. Number 40, COPD. Number 41, brain tumors. Number 42, persistent cough, enlarged prostate, colon cancer, blockages in the carotid arteries. And number 43, chronic obstructive lung disease, kidney disease, hypertension, and heart problems, deceased. Every person on that list is somebody's son, somebody's father, somebody's husband. My dad is on that list. I know that this is just the tip of the iceberg. I know that there's more people out there. I have a can of McIntyre powder here. It's a lot smaller than I thought it was going to be, particularly for how much damage that I believe it's done. On one end it says that it's made from the McIntyre Research Foundation in Toronto, made in Canada, use patented, sold only to licensees, not for resale. The McIntyre Research Foundation sounds like a great organization in terms of research. Basically, it was made up of mining executives and a couple of doctors, members of the Ontario Mining Association. The other side of the can, McIntyre powder, approximate content, 10 grams of aluminum, 15% aluminum oxide, 85%, for silicosis treatment, for use only under doctor's direction. I can tell you that I've met with 2 people, former miners, who were responsible for dispensing these cans of ground up aluminum in the mining dries and in the specially constructed chambers for silicosis. For the dispensing of this to prevent silicosis. And both of those miners were approximately age 20 when they started dispensing this stuff. They were not doctors. This was not done under medical supervision. They were students and young men starting at a mines, and they were told to go put these canisters in an apparatus, puncture them, send compressed air through them, and a big black cloud would come out that my dad and other miners like him inhaled before they went into the mines every shift, every day, 5 days a week. My dad was one of those miners, and I believe his Parkinson's was related to inhaling a neurotoxin. I'm really hoping to hear from you, from your stories. If you're a miner who's been exposed to this and experiencing some health problems, let me know. I have a website, McIntyrePowderProject.com, Facebook page, McIntyre Powder Project. There's information on those pages as to how to reach me. I have an email through Yahoo. Hopefully, if enough of us come forward, we can start to make some changes, start to stimulate some research, start to make some people who made these decisions a little nervous as more and more of us come forward. So I appreciate everybody who has come forward so far. Thank you for sharing your stories. It is not lost on me that these are real human beings, that the families have suffered, that people who love them have lost people. So thank you very much, and please contact me. Take care.